young stroke, when I say by definition, Dhwani, what does young stroke mean? By definition, how young should he be to be labeled as a young stroke, where you seek alternative causes of weakness?
Less than 40 years, sir.
Very good, he should be less than 40. So conventionally, you expect stroke to be after 40. About handedness, Saloni, should you put handedness in demography, in your opinion? Should handedness be included in demography, yes or no?
So yes, because usually it signifies that if the Broca's area would be affected or not.
How do you come to know where is Broca's area is?
So it is mostly in the inferior frontal gyrus of
No. Not on imaging. In case, how will you come to know where is Broca's area is?
So if the patient is a right-handed, then mostly
how do you know if he is a right-handed?
The patient will
say yes, he is right-handed.
We'll ask the patient to write or something like.
If you ask him to write something to check his handedness, what have you done? अगर तुमने पेशेंट को बोला write or brush in front of me, I want to see your handedness. Yeah, that is examination. Okay, please understand, handedness ideally should be in examination. My suggestion, it's entirely up to you. Don't put handedness here, put it in local examination. Because handedness is an examination finding. There are ways to identify it. Like how she said, ask him to write. If he is able to write, considering he does not have right-sided weakness, then you will say he is right-handed. वो तो झूठ भी बोल सकता है ना. So demography में, if they ask you क्यों नहीं पूछा, then your answer will be handedness is an examination finding. It's a safe answer. See, nothing in neurology is black and white. Many things are not. These kind of things is where people get stuck. If you don't say handedness and if he asks you क्यों नहीं बोला, okay, if he say, then you say it's an examination finding. इसलिए नहीं बोला. Okay, better than getting stuck this way. What if patient is uneducated? Advik, this was not my way of checking handedness. This was her way. There is a different way to check handedness beyond the scope at this stage. Ideally, you should be telling me. उसको बोलना ही नहीं चाहिए था, ask him to write. वो तो गलत ही है. और आजकल कौन नहीं लिख सकता है? Then you come to chief complaints. Headache, vomiting, convulsions, weakness. तुमको कुछ अजीब नहीं लगा ये सुन के? Yes, Mugdashri Paul, please help me.
So I think like 1 to 2 chief complaints should have been mentioned instead of.
Mugdashri is getting a reminder of our first ever case presentation.
Yes, sir, you had told me this. Yeah.
I'm glad you remember. If it were me, I would not ever in any case in my life put 4 chief complaints. It is a disaster because every chief complaint will have to be in the ODP. If I were him, I would have put only 2 chief complaints. Obviously, one has to be weakness because this case is weakness. It's like saying Mudashri was presenting obstructive jaundice. The chief complaint has to be icterus or jaundice or yellowing of eyes. So weakness to honi chahiye. And you add any other of the 3 chief complaints which the patient deemed important. I would not add vomiting. I would not add headache. Maybe convulsions. Chalo chale. Agar hai to. Obviously, in most of your hemiplegia cases, convulsions will not be there. It's a rare finding for obvious reasons, which you will discuss. So, 99% of the times, your chief complaint should only be weakness. And maybe if he has facial weakness also, if at all. So, 2 chief complaint both ho gaye, 1 chief complaint is ideal. If you are thinking of hemiplegia due to stroke, the way you do examination in stroke, same will be your history of associated symptoms. Okay, same way. You will do motor examination, you will do cranial nerve examination, you will do sensory examination, you will do cerebellar examination, you will do special examination. Similarly, you ask over here. Okay, very similar. It will become supremely easy if you follow the system. All right. So you got weakness. So what are your associated symptoms going to be apart from weakness? You can ask about cranial nerves because this will also tell you what is the location of the stroke or the infarct or the hemorrhage. It will also localize. It will tell you the extent of the disease and it will give you a clue to localization. Please understand, if there is a stroke in the cortex or for that matter even in the subcortical corona radiata, you do not get cranial nerve features. You don't get cranial nerve features because all my face, oral cavity, whatever the cranial nerve supply, they go to both the cortexes or both the hemicortex, left and right hemispheres. दोनों तरफ जाती है. For example, let's say you talk about eyes, eye movement. That means there is third cranial nerve. Now, eye movements are controlled from maybe frontal lobe, maybe occipital lobe. These fibers come from both the sides. Okay. And what they are going to do is they will not only cross, they will also go on the same side to the third cranial nerve nuclei, to the fourth cranial nerve nuclei. So what will happen is if there is a stroke over here and these fibers are cut, opposite will still supply. So I never get cranial nerve weakness or cranial nerve distribution of sensory or motor loss if it's a stroke which is in the cortex or in the corona radiata, subcortical areas. Because all my cranial nerves go on both sides. So my third nerve control comes from both the cortex or both the hemispheres. Fourth nerve control comes from both the hemispheres. Fifth nerve is also both hemispheres. Everything is both hemispheres except, except, which is the only
The
part
lower
which is
part of face.
lower part of face. So, you know, whenever we talk about stroke and hemiplegia, we always say lower half of face. And what do we say? That's because upper half is bilateral. It's not upper half. Everything is bilateral except lower half of face. So that's why in stroke, if it's of cortical origin, we always talk about lower face weakness because upper face bilateral, oral cavity bilateral, eye movements bilateral. So palatal movements bilateral, tongue movements bilateral, everything is bilateral except lower face. That's why you get lower facial weakness in a cortical stroke, which is on the area of the face. आगे बात समझ में? So please don't be under the impression that lower face and upper face are different. Lower face is different from everything else in cranial nerves. Everything else is bilateral on the cerebral cortex. Okay? Anyways, come back, Saloni. Tell me, how do you ask for each of these cranial nerves quickly? You can simplify your cranial nerves in just 4 or 5 words. 4-5 words अगर तुमने पूछ लिया ना, 4-5 words which can all be put in 1 or 2 lines. You will be done with cranial nerve weakness in one go. Why are they called cranial nerves? How are they different from peripheral nerves?
Sir, peripheral nerves are through spine.
Anatomically nahi dost. How are they different in function from other
Sir,
nerves?
they have mixed and a special.
Matlab, why are you guys different from other people going for surgery practicals? Because you are special. Because you have special effects or special functions which other parts don't have, which are called your special senses. All your cranial nerves are responsible for your special senses or special functions, which are not normal functions as seen in the rest of the body. If you want to put it in simple words, if I want to ask for cranial nerve loss, can't smell. So no difficulty in smelling, no difficulty in vision. ये हो गया आपके फर्स्ट एंड सेकंड. थर्ड भी आ गया इसमें विजन में, सेकंड, थर्ड, फोर्थ, सिक्स्थ. नो डिफिकल्टी इन स्मेल, नो डिफिकल्टी इन विजन, नो डिफिकल्टी इन हियरिंग. ये आ गई 8. अभी 5, 7, 9, 10, 12, all of them are to do with your mouth. Taste, chew, speak, swallow. बस हो गया काम खत्म. If all of these are intact, there is no cranial nerve weakness. If there is a cranial nerve weakness, or if there is a weakness in the distribution of any of them, which will typically be over here, then you tell that first, that on the left side, patient has drooling or saliva. Bas, on the left side. Baat khatam. That means probably he has left lower facial weakness. Rest of the things are fine, means smell, vision, hearing, chewing, swallowing, speaking are all fine. एक लाइन 2 लाइन में आपके सारे क्रेनियल नर्व हो जाएंगे. एंड लेट मी टेल यू, हेमीप्लेजिया में क्रेनियल नर्व इन्वॉल्वमेंट नहीं होती अनलेस इट्स अ ब्रेन स्टेम स्ट्रोक. क्यों होगा? ब्रेन स्टेम स्ट्रोक में अफेक्ट होगा वरना नहीं होगा. एंड ब्रेन स्टेम स्ट्रोक्स आर वेरी रेयर. मोस्ट ऑफ द स्ट्रोक्स आर कॉर्टिकल और इंटरनल कैप्सूल, सो यू एक्सपेक्ट दोज ओनली. तो एक ही बारी में आपके एसोसिएटेड सिम्टम्स हो गए क्रेनियल नर्व के. व्हाट इज द पर्पस ऑफ डूइंग हायर फंक्शन?
So to know if the cerebral cortex has been involved.
Wonderful. That's exactly what I wanted to hear. You put it bang on. Whenever I say higher function, please understand whatever I check in higher function. Higher means developed function. It means if anything in higher function is deranged, normally it is a problem in the cortex. Okay. Subcortical lesions, brainstem lesions will not affect higher function normally. Few exceptions, not important. ओके ये मेंटालिटी समझो. आप हायर फंक्शन क्यों चेक कर रहे हो? इट इज नॉट बिकॉज यू आर इंटरेस्टेड इन द पर्सन्स लैंग्वेज एंड स्पीच एंड व्हाटएवर. इट्स बिकॉज यू वांट टू नो इज द कॉर्टेक्स इन्वॉल्वड. नाउ व्हाट आर दीस हायर फंक्शंस? देयर आर मेनी. व्हिच वन विल यू चेक इन योर एग्जाम? ही सेड consciousness and he said orientation. I would put them as optional, but ठीक है, you can check. Purushat, consciousness में what do you check?
So the GCS.
Let's not check GCS in stroke. Something simpler, something more bedside. When you check consciousness, there is a bedside assessment. And I'm surprised nobody has spoken, even Harsh didn't say anything. It goes by this abbreviation. A, B, T, U. बहुत जगह पे पढ़ा होगा. A means alert. B means responding to verbal commands. So he is verbalizing. Responding to pain. Unresponsive or unconscious. Okay. This is what is used in intensive care patients. This is what you will answer in a stroke patient. Consciousness, is he alert? Or is he responding to verbal commands? Is he responding to painful stimulus, or is he unconscious? Oriented, yeah, you can say oriented to time, place, and person. We have done this in surgery. Which surgery case में please मत बोलना time, place, and person. Purushat, why time, place, and person?
So because while recovery, person recovers in the reverse order.
Wonderful. He will recover in reverse order. So if he is disoriented in all of these three, the recovery will be in reverse order. These will be deranged, usually in cortical lesions. Usually. Subcortical में भी हो सकते हैं. अभी important क्या है हमारे? तीन है. There are just three things which are important in higher function. One is handedness, second is speech, and third is memory. ये तीन ही आप higher function check करना है. Please understand, these are truly cortical functions. Okay, a lower animal, a dog with an underdeveloped cortex will not have right-left handedness. He will not have speech like human being. He will have some memory. Some vertebrates have memories. Primates have memory. But lower animals will not have memory. They will not remember इसने मुझे गाली दी थी. Like how many of you remember, right? So it is a problem, unfortunately, your memory. Now, first thing is handedness. See, I feel handedness should come in and not in your demography. Purusharth, how do you check for handedness? Answer is not asking him to write. Okay, because he can be illiterate.
So we're asking him to pick up an object.
Simpler way. Something that does not require much power. Akshi is saying, catch a ball thrown suddenly. Ball लेके जाएगी. हाँ, न्यूरो केस में बॉल फेंकेगी. Throw a ball. यशवी, ये क्या साइन का टेस्ट है? This is how you do it in LTMC क्या? यशवी भी.
We were told that you throw a ball and check whether the patient moves like in the direction of the ball or not.
You ask the person to fold his hands if there is power. You can check handedness if there is some power, at least grade 2, grade 3. You ask him to fold his hands. Like this. So when he folds his hands, the hand which is in front is the dominant hand. Okay, this is one bedside test. ये मेरे आंसर नहीं है, ये सब बुक्स में दिए. The hand in front. अगर आप में से कोई लेफ्टी है, you can check it yourself. The left hand will come in. If you are a righty, your right hand will come in. So the hand in front. There is another way, जो military में करते हैं ना, attention, and then you say stand at ease, where you put your hands behind. The hand which goes behind is the dominant. Okay, आप अपने आप पे try करो. If the person can walk, you give him a football, you ask him to kick. The foot with which he kicks, sine wave, that is his dominant. Most people who are righty, so most people who are right-handed will have left cortical dominance. Purushad, what does this mean?
So it means their left cortex will be responsible for their speech, their all the higher mental functions the left cortex will do.
Speech areas are in the left cortex. First, only one thing. The word dominance comes from speech dominance. So if he is having speech areas in the left side, means Broca's and Wernicke's, that means he is left dominant. Okay, that means speech areas are in the left side. And 95% people who are righty will have their speech areas in the left cortex. Purushad, what about someone who is lefty?
So in a left-handed individual, 70% of the people will have their, again, left cortical dominance. Only 20% patients will have right cortical dominance.
Okay, from the sources that I have read, it is 50-50. If I am left-handed, I will have right cortical dominance in about 50% people.